My name is Karima Williams, and I'm here at the world-renowned Children's Hospital of Philadelphia. And today my guest is Dr. Stephen Willi, Director of the Diabetes Center here. Thank you so much for having us.
It was a pleasure to be with you.
So first things first, please explain what is juvenile diabetes?
Is distinguished from adult type diabetes or type 2 diabetes because it presents in children.
Right.
It usually presents abruptly with an illness and can be life-threatening initially.
Wow.
It's a condition that results from a lack of insulin in the body, which is a hormone that controls blood sugar.
Right. Okay. So how soon might a child be able to be diagnosed for juvenile diabetes?
We have children presenting to the Diabetes Center here as young as 1 or 2 years of age.
Wow.
It occurs most commonly in the early teenage years,
right,
age 12 or 13, but can even present in adults.
Wow. What are some treatment options? What do you...
Well, to date, we're working on research to to find new treatment options, but to date, since 1921, since the discovery of insulin, has been to replace the insulin that the body is lacking.
Okay.
This is done in injections or by using an insulin pump.
Okay. So the role here, what role does the Diabetes Center play with families of children who have diabetes and caregivers?
Sure.
Helping those families?
Yeah, we work with families from the time of their diagnosis, the child's diagnosis, to educate them about taking care of the diabetes. Diabetes requires multiple decisions being made, and this is not something that you can call the doctor about every moment of the day.
Right.
What we do is we focus our attention on training families on how to manage the diabetes successfully. And then we follow them through the course of the condition and act as coaches to try to get them to do the best they possibly can to allow the child to live a full and a meaningful life while managing their diabetes well.
Okay, so for a new patient who has been diagnosed with diabetes, juvenile diabetes, how might they be managed here at this center?
So when they present to us, oftentimes the child will be ill and they will require hospitalization. So the children will be admitted to the hospital for several days to manage their condition and to do intensive education of the family so that they can care for the child at home. There's a transition that occurs to our outpatient programs. We have a number of outpatient centers throughout the Philadelphia area so that patients can be managed closer to home. Those outpatient visits include comprehensive diabetes education and support services as well as routine monitoring that is done.
Okay. If parents need to reach the center, what numbers or...
Sure, so we have several ways you can contact us. We have a website. It's chop.edu/diabetes.
Okay.
We're also on Facebook, and there are links to our Facebook page at the website.
Okay, great.
And then there's a phone number, 215-590-3174.
Okay. Well, thank you so much for having us here.